12 Weird Skin Signs of Diabetes. Have you ever noticed strange changes in your skin that you couldn't quite explain? Maybe you're seeing unexplained rashes, discoloration, or even skin tags. While it might just seem like an ordinary skin issue, these skin signs could be pointing to something much more serious: diabetes. Surprisingly, diabetes doesn't always show up with obvious symptoms until it's too late. And by the time you realize something's wrong, it may already be causing long-term complications. In fact, more than 400 million people worldwide live with diabetes, and many don't even know they have it. The good news is, your skin can give you early warning signs if you know what to look for. That's why today, we're uncovering 12 weird skin signs that could indicate diabetes. Understanding these symptoms could help you catch diabetes before it spirals out of control, leading to more serious complications like heart disease, kidney failure, and even nerve damage. So let's take a closer look at your skin. It may just hold the key to your health. Let's start with one of the most common signs: dry, itchy skin. It might sound like something minor, but it could actually be a major indicator that your blood sugar levels are out of balance. People with diabetes often experience dehydration due to the body's inability to regulate fluids properly, especially when blood sugar levels are elevated. This dehydration can lead to the skin becoming dry, flaky, and even prone to irritation. It's not just an uncomfortable feeling, it's a clue that something deeper might be going on. When blood sugar levels remain high, it can interfere with the skin's natural ability to retain moisture. Normally, the skin relies on compounds like ceramides, which act as a moisture barrier, helping to lock in hydration and keep your skin smooth. However, when diabetes disrupts this process, it compromises the skin's moisture barrier, leading to dryness and discomfort. A study published in the Journal of Diabetes Research found that nearly 80% of people with diabetes experience some form of skin problem, with dryness and itching being among the most common. Shocking, right? It's a widespread issue that can signal deeper health problems. In fact, research shows that skin problems, including dryness, are often one of the first warning signs of uncontrolled diabetes. The prevalence of dry skin among people with diabetes is high, and it's estimated that about 50% of people with diabetes experience some type of skin condition related to their disease. So, if you've been noticing persistent dryness or itching, it's worth paying attention to. Your skin might be telling you something important. Next up, let's talk about skin tags. These small, soft growths that tend to appear in areas where skin rubs against itself, like under the arms or around the neck, might seem like just a minor nuisance, but they can actually be a red flag for diabetes. When your insulin levels are elevated, which happens when your body isn't using insulin properly or efficiently, it can trigger the growth of these little bumps. While skin tags themselves aren't harmful, their presence can indicate that your blood sugar levels are out of balance. The link between insulin resistance, a hallmark of type 2 diabetes, and skin tags is quite well documented in scientific research. Insulin resistance occurs when the body's cells no longer respond effectively to insulin, leading to higher levels of insulin circulating in the blood. This excess insulin can stimulate the skin's growth factors, contributing to the formation of skin tags. In fact, studies have shown that people with insulin resistance are more likely to develop skin tags, and this can often be one of the first visible signs that diabetes might be growing or is not being managed properly. In a surprising statistic, research suggests that up to 60% of individuals with type 2 diabetes experience skin tags. While they may appear harmless, if you notice multiple skin tags or ones that seem to pop up suddenly, it's worth taking a closer look at your blood sugar control. The appearance of these growths can be a subtle yet telling sign that something is off with your metabolism, signaling a need for attention and possibly a lifestyle adjustment. Then there are darkened skin patches, often referred to as acanthosis nigricans. This condition causes velvety, dark patches of skin to appear in areas like the neck, armpits, or groin. While these patches may seem like just a cosmetic issue, they can actually be a significant warning sign of insulin resistance, a key factor in the development of type 2 diabetes. Insulin resistance occurs when the body's cells become less responsive to insulin, prompting the pancreas to produce even more insulin to compensate. The excess insulin in the bloodstream stimulates the growth of skin cells, which leads to the formation of these discolored, thickened patches. Acanthosis nigricans is often one of the earliest signs that diabetes might be on the horizon. In fact, it's more commonly seen in individuals with high insulin levels, a condition that frequently precedes the onset of type 2 diabetes. Studies show that the prevalence of acanthosis nigricans is higher in people with insulin resistance, and it can serve as an important visual clue that your body is struggling to manage blood sugar properly. For instance, research has found that nearly 30% of people with insulin resistance experience acanthosis nigricans. This condition isn't just about appearance, it's a sign that your body is dealing with an imbalance in insulin regulation. If you spot these dark patches on your skin, it's a good idea to monitor your blood sugar levels and speak with a healthcare provider. Acanthosis nigricans can be an early indicator of developing diabetes, and catching it early can make all the difference in preventing long-term complications. Another strange but telling sign is blisters. Yes, you can get blisters that pop up out of nowhere, but these aren't your typical blisters caused by friction. They appear as a result of blood vessel damage from high blood sugar. This phenomenon is known as diabetic blisters or bullosis diabeticorum, and while it's rare, it can be a strong indication that your blood sugar levels are not properly managed. These blisters usually appear on the hands, feet, or legs, and are typically painless, making them easy to overlook. However, the presence of these blisters can point to underlying damage to the small blood vessels, a consequence of long-term high blood sugar levels. When blood sugar is elevated over time, it can lead to poor circulation and damage to the blood vessels, particularly in the skin. This blood vessel damage can disrupt the skin's ability to heal and maintain its structure, leading to the development of these blisters. The exact cause of diabetic blisters isn't fully understood. Still, they tend to occur more frequently in people who have had diabetes for several years, particularly if their blood sugar levels have been poorly controlled. While these blisters are rare, they serve as a clear signal that the body is under strain due to high blood sugar. Studies suggest that the occurrence of diabetic blisters should not be ignored, as they can signal the need for better blood sugar management. Next, you may sometimes also notice red, swollen, or itchy bumps, which could be a condition called diabetic dermopathy. These bumps usually appear as brown scaly patches on the skin, most commonly on the legs, and they're one of the more frequent skin signs of diabetes. Diabetic dermopathy occurs due to changes in the blood vessels, a direct consequence of poorly controlled blood sugar levels over time. High blood sugar can damage the small blood vessels, capillaries, in the skin, leading to poor circulation and making the skin more prone to injury. As a result, these brown patches form as a healing response to minor injuries that might not even be noticeable. While diabetic dermopathy is often harmless and doesn't typically cause pain, its presence signals that blood circulation may be impaired due to diabetes. The skin becomes less able to repair itself, and small unnoticed injuries can lead to these visible patches. They may start as small red bumps and evolve into larger scaly patches over time. Though they don't usually require treatment, it's important to recognize them as a sign that blood sugar management could be improved. The prevalence of diabetic dermopathy is quite high, with studies suggesting that around 50% of individuals with diabetes will experience some form of it, particularly as they age or as their diabetes progresses. It's another reminder that skin changes, while seemingly minor, can provide key insights into the state of your overall health. Foot problems are another key indicator of diabetes, and they can be a serious concern. High blood sugar levels over time can cause nerve damage, known as diabetic neuropathy, which leads to a loss of feeling in the feet. This makes it harder for people with diabetes to notice cuts, blisters, or other injuries. As a result, minor wounds that would usually heal quickly can become major problems as they go unnoticed and untreated for longer periods. The nerve damage from diabetes also affects circulation in the feet, which means that even when injuries are noticed, they take much longer to heal. This poor circulation can lead to an increased risk of infections, ulcers, and even gangrene in severe cases. If you notice sores or open wounds on your feet that seem never to heal or heal extremely slowly, it could be a sign that your blood sugar is poorly controlled, affecting your blood flow and immune response. Studies show that people with diabetes are at a significantly higher risk of developing foot ulcers, and about 15% of individuals with diabetes will experience a foot ulcer in their lifetime. Diabetic foot complications are one of the leading causes of hospital admissions for people with diabetes, and in severe cases may lead to amputations. These issues often arise due to a combination of factors: nerve damage, poor circulation, and weakened immune function, all stemming from long-term elevated blood sugar levels. Another common skin condition linked to diabetes is Candida infections or fungal skin infections. When blood sugar levels are consistently high, they create an environment that promotes the growth of fungi, especially in warm, moist areas like under the breasts, in the groin, or between the toes. Candida, a type of yeast, thrives in these conditions, leading to infections that can cause symptoms like redness, itching, irritation, and discomfort. High blood sugar encourages fungal overgrowth because excess glucose in the body can be excreted through sweat, providing a food source for fungi. In areas where the skin is naturally more humid, like folds and creases, the combination of moisture, warmth, and sugar becomes an ideal breeding ground for Candida. This is why people with diabetes are particularly susceptible to fungal infections, especially if their blood sugar isn't well managed. Candida infections can range from mild to severe. If left untreated, they can lead to more serious complications, including the spread of infection or a chronic condition that requires extensive treatment. In fact, recurring fungal infections are a red flag for poor blood sugar control and could signal that your diabetes needs better management. Studies have shown that people with diabetes are at a higher risk of developing fungal infections, particularly when their blood sugar levels are consistently high. And then there's yellowish skin, which could be a sign of high cholesterol levels, a common issue in people with diabetes, particularly those who have had the condition for a longer time. When blood sugar is poorly controlled, it often leads to an increase in cholesterol and triglyceride levels. This imbalance can result in a condition called xanthomas, where fatty deposits form under the skin, giving it a yellowish appearance. These deposits typically appear in areas like the eyelids, elbows, knees, and around the hands and feet. Xanthomas are more than just a cosmetic concern. They signal that your body's lipid levels are out of balance, often due to uncontrolled blood sugar. High cholesterol and triglycerides can also increase the risk of heart disease and other cardiovascular problems, which are already more common in people with diabetes. The presence of yellow patches on the skin is, therefore, an important sign that both your blood sugar and lipid levels need to be managed more carefully. Interestingly, studies have shown that people with type 2 diabetes have a significantly higher risk of developing xanthomas, particularly if they also suffer from conditions like hypertension or obesity. The fatty deposits are a visible reminder that the body is struggling to regulate both blood sugar and fat levels, and it's a call to action for better management of diabetes through diet, exercise, and possibly medication. Slow wound healing is another alarming sign of poorly controlled diabetes. When blood sugar levels are consistently high, they can impair the body's ability to heal itself, particularly when it comes to skin injuries. Diabetic skin is less efficient at repairing itself due to poor circulation and nerve damage. The combination of impaired blood flow and decreased nerve function makes it harder for the body to deliver oxygen and essential nutrients to the affected areas, which slows down the healing process. Elevated blood sugar levels can lead to poor circulation in people with diabetes, especially in the extremities. This poor circulation reduces the skin's ability to receive the nutrients and oxygen necessary for tissue repair. Furthermore, nerve damage from high blood sugar, diabetic neuropathy, can dull the sensation in the affected area, meaning small injuries may go unnoticed until they worsen. As a result, cuts, scrapes, and even minor abrasions can take much longer to heal. Studies show that people with diabetes are more likely to experience slow wound healing, and this issue becomes even more prominent when blood sugar is not well managed. In fact, delayed wound healing is one of the main contributors to foot ulcers and other serious complications in diabetics. Slow healing is not just an inconvenience, it's a signal that your blood sugar levels need attention. Then there are skin infections, which are more common in people with diabetes due to the impact of high blood sugar on the immune system. When blood sugar levels are poorly controlled, the immune system becomes less effective at fighting off infections. This makes individuals with diabetes more susceptible to a variety of skin infections, including bacterial and viral ones like boils, styes, and even shingles. The high glucose levels in the bloodstream provide a breeding ground for bacteria and viruses, making it easier for infections to take hold. Bacterial infections, such as boils or cellulitis, are often the result of bacteria entering the skin through small cuts or abrasions. These can become more severe and take longer to heal in individuals with diabetes due to the impaired immune response and poor circulation. Viral infections like shingles, which are caused by the varicella zoster virus, can also be more frequent in people with weakened immune systems. And the skin rash associated with shingles can cause severe discomfort and complications. Research has shown that people with diabetes are more vulnerable to infections because high blood sugar can reduce the function of white blood cells, the body's primary defense against pathogens. Elevated glucose levels can also impair the skin's ability to form a protective barrier, increasing the risk of bacterial and viral invaders. Decreased skin elasticity is another important sign to watch out for. When blood sugar levels are not managed properly over time, the skin's ability to bounce back after stretching begins to diminish. This happens because high blood sugar promotes the formation of advanced glycation end products, AGEs. These harmful compounds form when excess glucose binds to proteins like collagen and elastin in the skin, causing them to stiffen and break down. Collagen and elastin are crucial for maintaining skin firmness and elasticity, and when they're compromised, the skin loses its ability to stay tight and supple. As a result, the skin may start to sag, become loose, and feel less elastic. This is particularly noticeable in areas like the face, arms, or abdomen. Over time, as ages accumulate, the skin becomes more fragile, and the aging process accelerates. Decreased skin elasticity is often a subtle sign of long-term elevated blood sugar, which can be a result of poorly controlled diabetes. Scientific studies have shown that ages are not only linked to aging skin, but are also a marker of poor blood sugar control. In fact, people with diabetes tend to have higher levels of ages in their skin compared to those without the condition. This is one of the many reasons why effective blood sugar management is essential, not just for overall health, but also for maintaining the appearance and functionality of your skin. Finally, sudden or unusual acne breakouts can also be a sign of diabetes. Hormonal changes, particularly due to insulin resistance or excess insulin in the body, can trigger acne flare-ups. When the body becomes resistant to insulin, it compensates by producing more insulin, which can lead to an increase in sebum production in the skin. This excess oil can clog pores, leading to breakouts, particularly on the back, face, or chest. Acne is commonly associated with adolescence, but when it appears unexpectedly in adults, especially if it's persistent or severe, it could indicate an underlying issue with blood sugar or insulin regulation. Studies have shown that people with insulin resistance, a hallmark of type 2 diabetes, are more likely to experience acne and other skin issues due to the hormonal imbalances caused by high insulin levels. These imbalances can disrupt normal skin functions, making acne more frequent or difficult to treat. What's concerning is that acne breakouts related to insulin resistance can sometimes be a warning sign of metabolic syndrome or even undiagnosed diabetes. Start noticing persistent or unusual acne that doesn't respond to typical treatments. Remember, early detection is key when it comes to diabetes. If you notice any of these skin signs, it's a good idea to consult with a healthcare provider for proper testing. Managing diabetes early on can prevent a lifetime of complications and protect your skin and overall health moving forward. Stay proactive, stay informed, and take control of your health before these small signs turn into bigger problems. Thanks for watching. If you found this information helpful, be sure to like, subscribe, and share for more tips on managing diabetes and overall well-being.